chronic disease management, specifically in a really expensive and serious heart health realm, is a place where I think wearables has the most impact today and in the near future.
Hey gang, it's Tuesday, May 17th. Lisa, Rajiv, and listeners, welcome to the Behind the Numbers Daily, an eMarketer podcast made possible by mParticle. I'm Marcus, and today I'm joined by two folks. We have with us our principal analyst who heads up our digital health practice. It's Lisa Phillips.
Hi Marcus, how are you?
Very good, very good. How are you doing?
Very well.
We're also joined by one of our digital health analysts. It's Rajiv Leventhal.
Marcus, Lisa, thanks. Happy to be here.
Yes. Today's fact. Some airlines have the pilot and the co-pilot eat different meals. Do we know why?
If one gets food poisoning, the other one's still there.
If something's wrong with the food, they won't both get sick. The New York Times notes that this follows an incident in 1982 in which 10 crew members of an overseas National Airways NC-8 flight, including the pilot, co-pilot, and flight engineer, became ill about 35 minutes out of Boston on a flight to Lisbon. They had to turn back around. The crew had all eaten different things, but the one thing they had in common was tapioca pudding. The Times also notes another incident where luck may have prevented a catastrophe aboard a Japan Airlines flight in 1975. 40% of passengers and crew flying from Tokyo to Paris became severely ill just as the plane landed for a fuel stop in Copenhagen. In Denmark, they had eaten omelets that were contaminated with a type of bacteria. The pilots who had boarded in Alaska did not become ill because it was time for their supper, not breakfast. So instead of eating omelets, they chose steaks.
The next flight I take, on my way to the seat, I'm going to pop into the cockpit and see what they're eating.
Different meals?
Yeah, and hope it's not pudding or omelets.
I just heard the most incredible story yesterday on NPR about a flight that had two passengers, one pilot, flying from the Caribbean to South Florida, and the pilot suddenly slumps over and is totally unresponsive. And neither passenger knew how to fly, but they had to get on the radio. The plane starts nosediving into the drink, and this air controller talked them into the airport to land. It was amazing.
Yeah, I caught that on the TV the other day. And if this person's not a pilot, which clearly they're not, they should be. Who just lands? Wasn't it nighttime?
That I missed.
That may or may not be true. Me and Victoria, who edits the show, we can't have the same meal because the podcast would shut down if we both got sick. Anyway, today's real topic, how wearable technology is changing healthcare. Smartwatches and rings, fitness trackers, other wearables can record over 7,500 physiological and behavioral variables, notes The Economist. Machine learning can then sift through mountains of data to reveal a continuous, quantified picture of you and your health. We're talking about mainly wearables today, but devices that you either put on yourself or put near you, and they can help monitor how you're doing and improve your health. Lisa, there's many definitions of what a wearable is or a health device. What do we generally include when we're talking about health-related wearables?
Well, here at Insider Intelligence, wearables are defined as fitness trackers, things like smartwatches, the rings you mentioned, and it's even clothing and so on that has sensors in it. But we don't include medical devices in there, like the continuous blood glucose monitors or smart thermometers. Those are more remote patient monitoring type devices.
Okay. We're going to be bouncing kind of between different types of definitions because we read a lot of different articles, Wall Street Journal, The Verge, The Economist, and they're all going to have relatively different definitions, but we're talking mainly about the same thing. Wearable things you put on yourself or near you that help detect how healthy you are. The Economist writes that individual firms may come and go, but wearables and AI, artificial intelligence, look set to reshape healthcare in three big ways. They say early diagnosis, personalized treatment, and the management of chronic disease. Early diagnosis, personalized treatment, and the management of chronic disease. Rajiv, I'll start with you. Which of these three ways will be the most groundbreaking in your opinion?
Well, personal treatment is a really big next frontier type issue that I'm not sure wearables at their current rate are able to, be a big factor right now, maybe one day. So chronic disease management of those is one that really sticks out. If you think about heart health, right? Heart disease is the leading cause of death in the US. 100 million American adults have high blood pressure, but many of them don't have their condition under control. And then you look at the number of adults over 60 with some sort of heart health condition, and it's pretty significant and it's expensive. So recently we've seen advancements in wearables' ability to do things like monitor your heart rate. And some of the newer ones have features like EKG sensors built inside that capture irregular heart rates. And some even have FDA approval for detecting these abnormalities. So chronic disease management, specifically in a really expensive and serious heart health realm, is the place where I think wearables has the most impact today and in the near future.
Mm-hmm. So Rajiv thinks management of chronic disease will be the most groundbreaking. For me, at least, personalized treatment jumped out, and it's because of one sentence in particular, or a passage in the article from The Economist saying, seeing people as individuals, not just as average humans, can really be beneficial. Most drugs work in just 30 to 50% of patients. If one person is regularly eating bananas that can moderate blood sugar, in another, it can raise blood sugar to levels that over time can cause harm. Algorithms can turn wearable data into bespoke prescriptions and diets for losing weight, controlling diabetes, etc. As Rajiv mentioned, maybe this is further down the line, but that one jumped out to me, personalized treatment. Rajiv says management of chronic disease. The other one was early diagnosis. Which one of these three do you think is going to make the biggest splash?
Immediately, because for me, healthcare is all about money. I have to go with Rajiv, the chronic disease management, because 20% of patients account for like 80% of the spending, at least for Medicare and Medicaid. So if you can just keep them on track and out of the hospital or out of an emergency room, right there, you're saving money. You can't prove a negative that you saved a bunch of money, but costs could go down. I mean, that's the impact most of healthcare is looking to see. I mean, doctors obviously are looking for patients' health, but the providers really want to see costs go down.
Yeah, it's a great point. There was another point in the article, which I think one of you has made to me before. Around 80% of disease, 80% of disease can be prevented by changes in how people lead their lives. So it may seem like you put this thing on your wrist and it tells you to do one thing or another and it tracks things which aren't going to do much to improve your health. But no, apparently a lot of what happens to your health is within your own control. So Laura Cooper of the Wall Street Journal, she notes that many folks have become accustomed to devices quantifying their steps or heart rate. That's just the beginning, she says. Businesses and researchers are dreaming up the next generation of methods to create and quantify personal data. She's got a couple of different ways here. One, measuring the quality of the natural environments we spend time outside in. So yes, you're outside, but what's the environment? Are you near a lake? Are you just walking down a pollution-filled street? Number two, dental data. Tracking acidity in the mouth may help forecast cavities before they happen. Number three, devices that assess optimum hydration levels for each individual. MIT researchers created a wall-mounted laptop-sized box for the home that analyzes electromagnetic waves around residents to gauge health metrics like breathing, heart rate, movement, gait, time in bed, length and quality of sleep. A few more, measuring blood sugar to track spikes linked to heart disease, stroke and diabetes. Smart thermometers that can detect specific strains of flu or COVID-19. Connected pet care, lots of different categories here. Lisa, I'll go to you first on this one. Which of these aspects of our health will wearables disrupt the most?
Ooh, you picked the wrong one to go to, I think, because I just got to say that all creeps me out.
Oh, interesting. Okay.
She didn't mention sleep, and that's one of the big specialties right now. I don't know. Rajiv, you want to pick this one up?
Well, this might be an easy way out, or maybe it's the hard way out. I'm not really bullish on any of these. I'm skeptical when I hear these features and what the potential of what wearables might do one day, because I think we're a ways away from that. The next step is to get doctors to really understand the data that's coming in from wearables today, right? Many wearables are still kind of intrinsically used for basic things like fitness tracking and steps and calorie counting and weight loss goals. And we mentioned the heart monitoring, the sleep tracking. So those I'd say are more advanced features. Before we get to the blood and the dental, I'd say we can, work on solving these issues first. Case in point is Apple, who's, obviously the biggest smartwatch company out there. And they were testing these blood pressure health-related features for its smartwatch for a couple years. And then a couple months ago, they were like, Yeah, this isn't going too well. We're going to put this off for a couple of years. So, and that's, blood pressure. Obviously, there's blood pressure devices out there, but if they can't kind of embed that capability into its smartwatch, it might not be a great sign for all of these other pie in the sky features.
So let me ask another question then. So The Economist said about a quarter of Americans have a wearable device. How they're defining that, we don't know exactly. But within a year or two, they say the device on your wrist could be measuring non-invasively your blood sugar, alcohol, hydration, markers of inflammation, kidney and liver function, all of which currently require blood to be drawn. As wearables acquire more features, users are less likely to lose interest in them and shove them to the back of the drawer. So I guess this is kind of turned, the question that I just asked, but kind of turned on its head. What health feature will make a wearable a must-have? If you were going to design one, or you saw Apple come out with a wearable device and it had X health feature, what do you think is going to be the real game changer here?
It's a good question. I like the sleep tracking. My wife just bought an Oura Ring, and they're
interesting.
They're really popular amongst athletes. And what she loves about it is that just a ring. She doesn't have to take it off, and it gives her all of her sleep data, like when she wakes up in the morning, where she has to improve, how many hours she slept, the quality, etc. I think that's really important. And if a smart watch can have that, or another type of wearable can have that type of feature on it and give accurate data and not make it too uncomfortable for the user, I think that's a potential game changer. That's
interesting, yeah, because you've said not just the sleep feature, but also the fact that it's a ring and it's less easy to notice, and so maybe that is more appealing than kind of strapping something to your wrist, perhaps. So a bit bulky as well. Lisa, how about you?
Well, I got to say, it all depends on what somebody is concerned about. We all go to sleep, so therefore I do think a sleep tracker is a pretty common device. We all have heartbeats, hopefully, and so that, if you're interested in that, my thing is, though, that doctors don't want to see this data unless it's real-world evidence, which comes from clinical med tech devices, like the continuous blood glucose monitor and so on. I've tried to show my doctor my cardio, my health app on my phone, and look how many steps I've taken and look at my, fitness. And he was like, oh, that's nice. Go away.
Huh. Is that because it's not been approved by a certain group of physicians and therefore... Okay.
I just wrote a report on digital doctors, and one of the big takeaways was 60% said no, they wouldn't store a patient's wearable data in their electronic health record. They just don't. Because it's just not worth anything to them.
Interesting. Okay.
Doctors just aren't thinking about wearable data right now. They go through their protocols and their clinical workflows, and maybe if the data was right there, it's they go into the patient's health record online and it just pops up right there. But I think even then, at least as you were saying, do they see value in what this device is generating? Will a doctor say, this is worth my time to review it and maybe change a treatment or whatever? We're not there yet.
Yeah.
Almost 50%, to your point, Rajiv, said they would not review data downloaded from wearables.
Wow.
From patients. So, I mean,
We're
like I say,
no,
it's still very hinky and unregulated.
I was just saying, on the consumer end quickly, it is a little bit different. They're becoming more bullish and enthusiastic. In a recent report, I noted that twice as many U.S. adults are saying they're wearing wearables compared to 2017, and almost half of those wear it all the time. They never take it off, which kind of goes back to the sleep tracking. So they're becoming more comfortable and more used to it, and the next step is getting the doctors to review the data and see value in it.
Yeah. So Amazon, let's talk about them for a second. They've got a new subscription service, relatively new, called Alexa Together. Helps care for family members remotely for $20 a month. It can notify you of family members' interactions with the assistant. You can get hold of them in an emergency. It offers hands-free access to an urgent response emergency helpline, and it's compatible with fall detection devices as well. Ian Carlos Campbell of The Verge was noting that. His colleague Nicole Wetzman of The Verge was saying Amazon has 2 new programs on top of this, which integrate Alexa into hospitals and senior living communities run through Alexa smart properties, where organizations can control a centralized Alexa system. The program lets senior living facilities use Amazon Echo devices to send announcements or other messages to residents' rooms instead of sheets of paper slipped under the resident's door, so staff can now be more available to do other tasks. Residents also can place calls to their Alexa device to their family members without having to rely on a staff member. So a couple of examples how Amazon's used its smart speaker to nudge itself into the world of healthcare. But folks, what will Amazon's biggest impact in the healthcare space be? Will it be the Alexa device or something else they're cooking up?
Well, I would say Amazon's biggest disruption will be pharmacy. That's not super relevant to this. It's it's pharmacy business. But yeah, like you mentioned, Marcus, these devices, these in-home devices they have powered through its voice AI technology, they're pretty significant. Recently, actually, they partnered with Teladoc, a telehealth provider, where through the voice assistant technology, through the Alexa, they can call a doctor in some cases. So, Teladoc has doctors, and I believe that's how it works.
They just say, I want to talk to a doctor, and they are connected to a Teladoc service, which then has a doctor contact them back.
Yeah. Okay.
In the device space, it's more about remote monitoring for Amazon than wearables, but they've made some significant inroads in remote patient monitoring.
Let's move to another tech giant. So according to the Wall Street Journal, Apple plans to include various types of monitoring in its new watch, including blood pressure, temperature, sleep, and blood sugar. Apple is also studying the potential of AirPods as health devices. Earbuds could be offered as hearing aids and include an in-ear thermometer and posture warnings, writes Rolf Winkler of the Wall Street Journal. So folks, what else can we expect to see from Apple in wearable health?
Well, the AirPods is a good one. 28 million U.S. residents experience hearing loss, but the overwhelming majority of those don't use devices. So could AirPods be a value add in that area? Perhaps, but when you think about Apple and wearables, it's all about the Apple Watch, right? They dominate the smartwatch category. I think they have like 40% of the worldwide market share.
Wow.
And the next closest is like 9% or something. And that's where Google and Fitbit are trying to carve into. Google purchased Fitbit a couple years ago for $2 billion. So Fitbit has a variety of trackers and smartwatches. And Google actually just this week at its developer conference announced that it's releasing its version of the Apple Watch for Android users later this fall. So we'll see if they can make some headway. But yeah, when it comes to Apple, I mentioned that they're putting aside that blood pressure feature for a couple years, but they're still the smartwatch leader by far. I think they sold 60 million Apple Watches just in Q4 2021 alone. So everyone else has a ways to go.
Mm-hmm. Yeah. Also dominant in the... Sorry, tell me, Lisa.
I got to say, can I just point out that the Apple Watch tells time? And it also plays music, and it does a heck of a lot of other things that are attractive to consumers. I don't think that's the health aspects of the Apple Watch that really are drawing a lot of people. Mm-hmm. Now, everything we've mentioned so far, I won't say all the chronic cases, but hit home with me. I would love to have AirPods as hearing aids, or at least a filter for when I'm in very loud restaurants and places. I think that has a huge growth potential if those devices are unregulated. Hearing aids right now have to be by prescription only. Mm-hmm. So there are some other things going on that might stunt some growth.
Yeah. If anyone's set up to do it, it's Apple. AirPods, the article was saying, dominate the global Bluetooth headset market, $13 billion in revenue for Apple in 2020, estimating research firm Strategy Analytics, 5 times the figure of the number 2 player, Bose. That's what we've got time for the lead. It's time now for the halftime report. A couple of takeaways from you both. Lisa, we'll start with you. Your takeaway from the first half.
These health and fitness is great, and there's very little context for people to see what the health data is, and their doctors don't necessarily want to know either.
Mm-hmm. Rajiv?
Lisa made a really good point that people are buying the Apple Watch for reasons other than the health. They just like the way it looks, its design, its music playing, podcast playing features. And I still think a lot of these smartwatches, even with their advanced health capabilities, they're not really the big features of the watch. And we'll see if they can get more advanced. But I still think intrinsically, these health features are still more on like the fitness and physical activity than anything more advanced. So we'll see how that progresses.
Time now for In Other News, but first, a quick word from our sponsor, mParticle. At the end of the day, your customer has to be at the center of everything you do. This starts with the right customer data strategy as well as the right foundation to solve the challenges that typically inhibit success, such as data quality, data governance, and connectivity. mParticle is your real-time customer data infrastructure that helps you accelerate your data strategy by cleansing, visualizing, and integrating your customer data from anywhere to anywhere. Ultimately, better data leads to better decisions, better customer experiences, and better outcomes. See why the best brands choose mParticle. Go to www.mparticle.com. Hi folks, we are back today in other news. Digital pharmacies get a smack on the wrist, and what should we make of telehealth companies' slowdown? Story 1. Digital pharmacies get a smack on the wrist. The Department of Justice has said that Amazon's digital pharmacy PillPack will pay nearly $6 million to the US government to settle overbilling charges, writes insider intelligence research analyst Aram Ahmed. The company admitted to dispensing insulin pens that exceeded days of supply to avoid Medicaid and Medicare limitations from 2014 to 2019. Aram also noted that the DEA began investigating pharmacy platform Wearable after reports it was prescribing Adderall and Ritalin to patients too often per insider. Some patients set up multiple accounts to receive drugs like Adderall, Aram noted. But Lisa, the biggest takeaway for you from this story is blank.
Is that online isn't unnoticed. And with this administration, they're taking a harder look at a lot more practices that have gone kind of unregulated, unnoticed.
And how do you see that developing and changing in the future? Because $6 million doesn't seem like a big deal for Amazon. So are they going to do something that really affects how digital pharmacies behave in the future?
Well, they actually didn't even buy PillPack till 2018. So that practice had been going on before. It's not going to continue because Amazon does do things above board, I would say, although some people would disagree, I guess. What I find interesting is that Wearable, the telehealth platform, was not policing its own prescription process. That's going to have to change. Other telehealth pharmacies should be watching that.
Mm-hmm. Story 2. What should we make of telehealth companies' slowdown? Virtual healthcare company Teladoc saw Q1 earnings grow 25% year on year, but company executives lowered their expected revenue for the full year 2022, notes insider intelligence research analyst Rhea Patel. On the one hand, Teladoc spent more on marketing its BetterHelp business that saw lower than expected returns. On the other, it's expecting decent revenue from its new chronic care business, Chronic Care Complete, Rhea notes. But Rajiv, Teladoc's deceleration of growth to you means blank.
Well, that the telehealth explosion of 2020 isn't quite the same as it is today. It was a rough financial quarter for Teladoc. They bought this online chronic care management company called Livongo right after the pandemic started for $18 billion. Livongo does virtual chronic care for diabetes and mental health and other conditions. Teladoc thought it was a good way to do this one-stop shop. They paid $18 billion for it. It was such an overpay. It's like buying a stock at its highest price. As of now, Teladoc's market cap is $6 billion. It's gotten nothing out of this Livongo deal so far, so we'll see going forward. But right now, I think it's fair to call that acquisition a bust.
Yikes. That's all we've got time for. Thank you guys for hanging out. Thank you to Lisa.
Thank you, Marcus. I enjoyed it.
Thank you, Rajiv.
Yeah, thank you.
And thanks to Victoria. She edits the show. Tune in tomorrow for the relaunch of the Behind the Numbers Reimagining Retail Show, the eMarketer podcast made possible by mParticle, where our new host, Sarah Lebo, will be joined by Andrew Lipsman, and they'll be talking all about D2C.